Hundreds of children's surgeries have been canceled as hospitals across the province grapple with an overwhelmed healthcare system. Tonight, a pediatric surgeon shares the distressing consequences of a growing backlog.
My colleagues are making decisions between the child with a brain tumor or the child that's going to lose their bladder function because of another problem in the spine.
Dr. Devin Peterson is the chief pediatric surgeon at McMaster Children's Hospital. He tells me they've been focusing on the more urgent brain and cancer surgeries, sending a wide variety of other life-altering procedures to the growing backlog, a situation he calls heartbreaking.
Cleft lip and palate, we haven't done any of those for 2 months. A lot of the urological surgeries, the hypospadia stuff. A lot of children with tonsils and adenoid problem that actually have trouble breathing, which is very dangerous, obviously haven't been done in 2 months either. A lot of our spine surgeries have been delayed as well, and we know the consequences downstream of that can be fairly significant.
What kind of impact can this have on these children stuck in the backlog?
A lot of these kids are missing time from school. Their parents are taking time off of work. There's a mental distress that comes with that can turn into mental illness in some of these children that is going to be long lasting. And the development delay with some of these kids is going to be just absolutely astonishing down the road.
Dr. Peterson says about 150 McMaster surgeries have been canceled so far, with another 50 to be postponed in January. This comes as Sick Kids reports nearly 300 procedures have been delayed, a number that will continue to grow as 6 of its 16 operating rooms have been shut down. Ontario only had 109 pediatric ICU beds heading into the pandemic. When RSV and flu hit early and hard this year, surgeries were postponed to make room for the surge of children needing critical care. In the last few months, more beds have been added to the system. We now have 130 across the province, but still there's not enough capacity or staff to ramp up surgeries.
A lot of our surgeries being canceled don't necessarily need the ICU. They just need a regular ward bed. We just need to get them in, and that's a majority of the stuff we're canceling. And that's even somewhat more heartbreaking because these are children that some need 1 day in hospital and that's it to get their surgery done, and we can't offer that to them.
Ontario's pediatric hospitals are planning for this surge to continue through the winter and possibly into March. And Dr. Peterson worries what the coming months will bring.
We're at the tipping point in surgery now that if this goes on much longer, I don't know what we do with these kids. A lot are going to end up coming through the emergency departments. I'm afraid some won't make it.
Now, McMaster is still doing day surgeries that do not require a hospital stay. And just to give you an idea of how busy the healthcare system is, Sick Kids Emergency Department normally has about 65,000 annual visits. This year, they're on track for more than 90,000. On Hospital Row, Shauna Hunt, City News.